Hello everyone, my name is Atira Marcelo Hernandez, and today we'll be talking about medication counseling by a pharmacist teaching patients for a better health. Did you know that patients visit their pharmacist 9 times more often than the primary doctors in a year? Many patients don't know how to take their medicines correctly, and this leads to bad use of the treatment, health issues, and in extreme cases, lead to death. To be able to talk about this topic, I did extensive research. As a student who has shadowed community pharmacists, I look for studies and scientific research to highlight how critical medication counseling is for effective treatment. That is why today I will be informing you of the risk that patients are exposed to when not receiving medication counseling and how a pharmacist helps to avoid this risk for the patient. The first point I will discuss is the common problem that can arise if a patient doesn't receive proper medication counseling. Many patients don't know the purpose of the dose or the side effects their medication can have. This leads to tons of medication errors. To fully understand the effects of the situation, we should know the process that a patient goes through to receive his medicine. First, the patient visits the primary doctor. Then the patient receives the prescription and visits the pharmacy. Then the pharmacy processes the prescription, and lastly, the patient receives the medication. Between these processes, the patient passes through the hands of different healthcare professionals. But for this presentation, we will focus on the last point. A list of common risks of not giving medication counseling are taking medications at the wrong time. If the patient needs to take the medicine strictly at a certain time, for example, 3 times a day or every 8 hours, and the patient is not aware of this specification, it can interrupt or alter the treatment. Mixing medications with other drugs or alcohol in drinks. If the patient has limitations to read or see well, can forget about what the medicine label indicates, leading to ineffective or worse secondary effects. Stopping medication prematurely will lead to a worse illness. For example, if a patient has a bacterial infection and is taking antibiotics after a few days, the patient can feel better and decide not to finish the treatment. This could lead to a worse infection because the bacteria can create resistance against the medicine. And lastly, interaction between drugs. If a patient is taking a medicine that needs to be suspended for a time to avoid interaction between those medicines, the patient can be exposed to a serious health risk. So, with all this risk, who is there to help us? The second point I will discuss is how pharmacists can help in avoiding this risk for the patient. Everyone has been a patient in their life, but there is a need to have an open interaction with your pharmacist so that more than having a successful treatment, trust can be developed. These are some of the actions that a pharmacist should take to help the patient. Orientating patients about their treatment. This point repeats constantly, but is the crucial point between a successful treatment or not. Explaining the possible secondary effects of the medication. This could be challenging, but the patient, by law, has the right to be informed about every detail of the medicine they're taking. Listen to the concern and doubts of the patient. This is as important as any other point because here is when the pharmacist builds confidence and trust in the patient, not letting the patient go with questions about their treatment. No matter how much work could be presenting the pharmacist at the moment, every patient must live completely clear about their treatment. Here's a short video where you will see how counseling should be addressed.
One school road. So I just wanted to talk to your medicine that you're getting to use. Is that okay? So we've got two slots of inhalers. Have you used those inhalers before? You have, right? Can you tell me how you're using them at the moment? Yeah, brown one, 2 puffs twice a day, and the blue one just whenever I need it. Okay, excellent. So like you said, your brown one you're taking 2 puffs, and that's twice a day, and your blue one you can take 2 puffs whenever you need to, and that's just for weeks. Okay. Can I check? Are you using any products over the counter? Any herbal medicine? Just painkillers, ibuprofen, paracetamol. Okay. So I can't afraid to use paracetamol. Ibuprofen I would be a little bit more cautious of just because you're an asthmatic patient. It's not suitable for every asthmatic. But happy to use paracetamol if when you need to. Okay. So you're happy how you're using your inhalers? Excellent. And have you got any questions for me at all? So if I could just get you to sign your prescription in the top box for me, that'd be great. That's excellent. Thanks very much. Have a nice day now. Bye.
Here are some statistics about the satisfaction of the patients from the service of a pharmacy. These show that there is a majority percentage that is satisfied with the service of the pharmacy. With all the gathered information, we can see the importance of receiving medication counseling and how pharmacy is involved in helping the patient. We discussed the possible risk a patient can be exposed to when not receiving a proper medication counseling from their pharmacist and the way that this health provider helped the patient avoid all this risk. With all being said, I wanted to end this presentation with a quote that says, "Pharmacy is not just about pharmaceuticals, it is about people." For any questions or concerns about medication counseling, here are the references and information you could use to your benefit. Thanks for your attention.